going to do a little bit of different order today. We're going to have the national anthem with Rusty and Audrey. Then we're going to follow with the four-way test. For all of you all who don't remember, it's right behind me. I'll get out of the way before we do that. And then at the end of the four-way test, I'm going to count to 3 and we're going to yell, "End polio now," while waving our purple napkins. End polio now, waving your flags. At the end of the four-way test. So, national anthem, four-way test, end polio now. Thank you, Audrey. That was great. And Rusty. So now we're going to recite the four-way test. And I'll get out of the way. For the four-way test of the things we think, say, and do. First, is it the truth? Is it fair to all concerned? Will it build goodwill and better friendships? Will it be beneficial to all concerned? 1, 2, 3. End polio now! Thank you. A little sandstorm, sort of. Purple storm.
Purple color.
Yeah. I did bring a purple mask today for the occasion, but I wasn't sure if it was more Rotarian than my Rotary mask. This is a Sewanee mask, the University of the South. Nicholas Beasley's here today. He's also a Sewanee grad. It's the only reason I could really find to use it today, but it's purple for the Sewanee Tigers. I thought I'd bring that. I can actually speak through it. That's interesting. Okay, next on the agenda for our invocation is Ed Tucker. Can we go ahead?
Let's go to the Lord in prayer. Our gracious Heavenly Father, we come before you today with hearts filled with gratitude for this beautiful day that you have given to us to enjoy and to serve you. We give you praise for you are the one true living God who is our Creator, our Redeemer, and our Sustainer. As we begin this new week, let us be mindful of our responsibility as a Rotarian to live and exemplify in the four-way test what we think, say, and do as we interact with others. We ask that you bless our efforts collectively as a club and individually as we work to spread awareness of the polio eradication campaign in the worldwide effort to end polio now. Father, we ask that you bless this food for the nourishment of our bodies and to feed and nourish our soul through your word and your truths. We ask all these things in the name of Jesus, our Lord and Savior. Amen.
Thank you, Ed. That was wonderful. For visiting Rotarians and guests, Richard Pollard is here to do the announcement.
Happy Monday, everybody. I do not believe we have any visiting Rotarians. Is it anybody visiting Rotarian? We don't have anybody signed up in front. I believe we do have a few guests. If y'all could stand up and introduce your guests, we have a microphone coming out to you.
Hello everybody, I'm Lee Lumpkin. I'm so delighted to have Karen McGrady, who is the Assistant Director, please stand Karen, with the Coker Center, and we're going to hear later about something that the Coker is helping to sponsor live on Lincoln, and she will help you with all your venue needs. Thank you.
Hi everybody, I'm Andrew Clarkson, Low Point Privilege. Today I started my first new job in 28 years. I'm now over at McWaters, so I'm selling AV stuff. And this is Michael Flynn. He is one of our project managers at AV at McWaters. And welcome, Mike.
Thank you both for being here today. Hope you enjoy it. And I know that we do have a little fun every now and then with some Rotary activities and this purple stuff. Health and Happiness, past president Rusty DePass is here. And of course we know he owns a lot of purple, so he's here today to give us the health and happiness.
Okay. Good morning, everyone. Mason asked me to take a minute or two to tell you about the early voting procedure. So I'll do that quickly. Some of you may have gotten an email from me about the early voting process and the opportunities that are available to people in Richland County. Of course, I think they're available to people in other counties as well. But you can only vote at one of these locations in the county in which you are registered. Unfortunately, we have people who stand in line for 30 or 45 minutes, and they get up to the front of the line, and there was a woman this morning who was registered in Newberry County. Well, good for her, but she can't vote there, and so it's kind of a waste of time. But if you are a registered voter in Richland County, it is possible to vote in person absentee. Now, I'll take up in just a moment how stupid that is, but absentee voting, of course, has been around for 75 years, and it's a great situation for old people in particular who just can't get there and or who are going to be out of town or for one reason or another. And so you apply for an absentee ballot. You apply for an absentee ballot, and one is sent to you, and you vote it and you return it, all in the mail. This year, of course, we have seen and heard some of the worst distortions of just everything involving voting, and it comes from both sides, and it really has complicated the process. Now you have states like California and Oregon, well, not California, Nevada and Oregon, and I think maybe Washington, they vote exclusively by mail. They do everything by mail, every time, every year, and there are differing opinions as to how well it works. But what has happened this year, and in the last few years, frankly, it's been creeping along, is that we go through this charade of having in-person absentee voting, so that you come in and you say you want to vote absentee, and you know, you don't really have to have a reason, although we put one down. The reason for most people this year is some kind of emergency, and which is meaningless, and it's also not the case. But anyway, be that as it may, You go through this charade through a process of applying for an absentee ballot. All this paperwork is totally unnecessary. What it amounts to is early voting. Well, I don't mean to pat myself on the back, but Jim Hodges was the chairman of the House Judiciary Committee back in the early 90s when I was chairman of the State Election Commission. And I asked Jim if he would join me in proposing early voting for South Carolina. That is, for say 2 weeks before the election, you would have polling places in all the public libraries, and anybody and everybody could go vote just like on election day. And he did. We made a big thing of it, and the Republicans in the legislature, who are not always my favorite people, believe it or not, they killed it. And so now we have this administrative nightmare that's going on in order to hang a shroud of some kind over absentee voting, over early voting, and call it absentee. So I tell you that so that after the election, if you would please, when you run into some of these highbrows who are our legislators, you might mention that this is a real good opportunity after a crisis year like this to enact early voting. It doesn't have to be for a month like it is this year, but anyway, to the bottom line, I am stuck every day. I volunteered to do this, granted, but I didn't realize what I was volunteering for. I have gone back to work full-time from 8 o'clock in the morning till 6 o'clock at night, and as a general rule, cannot even leave during the day. They made a special dispensation for me to come to Rotary to play the piano, and so I'm stuck down there. I'm making big money, as you can imagine, big money. Anyway, but I mean, there is a little bit of pay, but it's hardly worth it. Anyway, I'm stuck at the Prince Hall Masonic Lodge on Gervais Street. And so my estimation through 8 days of this, 8.5 days of this, is that 11 o'clock in the morning, today it was more like 10:30, and 3 o'clock in the afternoon are probably the best times, the slowest times, if anybody wants to come by and vote early. That's not to say that I think you should, that's not to say that I encourage you to, but if you want to, that's available to you. So keep that in mind. My cell phone number, as most people seem to know it, is 91-RUSTY. And so if you want to call and see if it's a good time, see if the coast is clear, I'll try to answer it, but I can't always do that. On Sunday evening, October 25th, from 5 to 7, at the Kroger Center for the Arts, we'll be presenting outside on Lincoln Street performances of 14 arts groups, including Columbia Classical Ballet, Columbia City Ballet, and the South Carolina Philharmonic. Dinner will be provided by the Blue Marlin. Tables are available for sale, seating 4 people at $250 through the Kroger Center box office. It will be a fundraiser to help all the arts groups and give everyone a chance to preview their seasons. So be aware of that. I have, well, I thought I had the announcement from the CART committee. Is that on my table over there? Oh, no, here it is, I got it. The CART message for today is we are making progress with heart disease and cancer. Deaths from those two diseases were down 9% between 2000 and 2017. We have a long way to go with Alzheimer's. We have no cure and no effective treatment. Deaths from Alzheimer's increased 145% between 2000 and 2017. Don't forget the blue buckets. Make checks out to the CART fund to ensure that the tax deductibility of your contribution. Thank you from the CART committee. I'm also told that Beth Irick's father died this morning. He was 94 years old, and as my daughter calls it, he had the woo, but this apparently, his death was apparently not connected with that. He had gotten over the virus, and I thought, in fact, Beth told me that he seemed to be doing well. So, but 94 years is a pretty good run, so please keep Beth in your thoughts and prayers. And I don't recall his name. We could look for an obituary. Do you know it?
Lloyd Hughes.
Lloyd Hughes. That's right. She was Beth Hughes. But yeah. Okay. Very quickly, let me tell you that complicating our voting situation is the fact that in Richland County alone, 76,521 absentee ballots have been requested as of Friday. 36,297 have been returned. Statewide, 460,845 absentee ballots have been requested. 684,277, beginning to sound like Joe Biden. 684,277 have been requested, and 451,400 have been returned. Everybody knows how I vote. I'm not trying to bend anybody over about that, but in fact, let me be serious for just a moment and tell you that I'm sure you would agree with me, no matter how old you are, that you have never seen a presidential campaign like the one we are witnessing this year. And let me tell you, I don't think it speaks very highly of our political system that we end up with a contest between these two guys. I just don't. Now, I have my preference. I know the one I like the least, and so I've made my choice and I've already voted, but it's just not a happy time, in my opinion. But I don't want to take away anybody else's excitement. And as I approach the end of life, I am moved by the story of this nurse and the wife of a patient in the hospital, and his daughter, and he had two sons, and they're all around his bed. And he asked for two witnesses to be present and a camcorder in a place to record his last wishes. When all is ready, he begins to speak. My son Bernie, I want you to take the Ocean Reef houses. My daughter Sybil, you take the apartments between mile markers 100 and Tavernier. My son Jamie, I want you to take the offices over the Marathon Government Center. Sarah, my dear wife, please take all the residential buildings on the bay side of the Blackwater Sound. The nurse and the other witnesses are blown away as they did not realize his extensive holdings. And as Doug slips away, the nurse says, your husband must have worked awfully hard to have obtained so much property during his business life. His wife said, property? He has a paper route. So such is life. Even at the end, you get put down by your wife. Speaking of which, and a little piece of trivia, my father would be 111 years old today, and I have already lived 3 years longer than he did, and so I'm living on borrowed time, I guess. But one more little item about retiree mental fitness. Most or many of you are retired. The test is to ascertain the mental state, how you're doing, and whether you need counseling and so forth. There are 4 questions to the test. There's the giraffe test. How do you put a giraffe into a refrigerator? Stop and think about it and decide on your answer before you answer. The correct answer is open the refrigerator, put in the giraffe, and close the door. The question tests whether you tend to do simple things in an overly complicated way. Question number 2 is the elephant test. How do you put an elephant in the refrigerator? Did you say open the refrigerator, put in the elephant, and close the door? Wrong answer. The correct answer is open the refrigerator, take out the giraffe, put in the elephant, and close the door. This tests your ability to think through the repercussions of your previous actions. The Lion King test. The Lion King is hosting an animal conference. All the animals attend except one. Which animal does not attend? The correct answer is the elephant. The elephant is in the refrigerator. You just put him in there. This tests your memory. Okay, even if you did not answer the first 3 questions correctly, you still have one more chance to show your true abilities. Question number 4 is the crocodile test. There's a river you must cross, but it is used by crocodiles and you do not have a boat. How do you manage it? The correct answer is you jump in the river and swim across. Haven't you been listening? All the crocodiles are attending the animal conference. This tests whether you learn quickly from your mistakes. And according to Anderson Consulting Worldwide, whatever that is, around 90% of the retirees they tested got all the questions wrong, and many preschoolers got several correct answers. Anderson Consulting says this conclusively proves the theory that most retirees do not have the brains of a 4-year-old. Have a nice week.
Thank you, Past President Rusty. We will miss you at the Past President's meeting after this meeting. And notice that he did not mention that the South Carolina Gamecocks won this weekend against Auburn for the first time since 1933. And he did not mention that Clemson won 73-7 against Georgia Tech. But did they cover the spread? I'm not sure. They did. Okay, next, don't forget the buckets. He did mention that. Next on the agenda is Cynthia Giles to talk about our purple polio stuff today. Come on up, Cynthia.
I'm back with purple hair again. I hope you guys are all doing well. Gotta turn this on. This Saturday is World Polio Day. What 2 countries do we still need to eradicate polio from? Anybody remember from last week? Perfect. So all of you wore purple today to help spread that awareness. I hope when someone asks you why you wore purple, you tell them about it. I've been wearing this all day, so I've been talking about it all day. We are encouraging you to participate in Bernie's 500-mile polio walk run challenge. I doubt he's running it. It is Bernie Rydell, so he is not running. He's walking it, and he's walking it for the next 2 months, and every dollar you donate to his challenge will be matched twice by the Gates Foundation and by Rotary International, so please go ahead and donate. Please go donate to this. This is our club's participation. We are not doing a separate polio challenge this year, and that's all I wanted to talk about, so please spread the awareness.
Thank you, Cynthia. Yeah, World Polio Day is this Saturday. It's October 24th. And the reason why it's October 24th every year is because it's the birthday of the guy who invented the polio vaccine. Salk. How do you pronounce his last name? Salk. There we go. All right, so that's why we're doing it this Saturday. So when you're watching South Carolina and LSU and not pulling for the purple, hopefully, you'll be thinking about World Polio Day. Okay. Next, briefly on the agenda, is Billy Canty from the Fair Board of Trustees. He's just going to quickly give a 1-minute update about what's going on across the street for the next 10 days. Billy?
Good afternoon, everybody. Mason asked me just to give a quick update on the fair. Starting tomorrow and Tuesday and Wednesday, we're doing a drive-through fair. The fair wanted to do something. They give over $300,000 in scholarships every year. And so, since we can't really have a fair in the normal sense, they're trying to drive-through fair, something different to entertain the youth, the people of South Carolina, and to show off the agriculture and mechanical the fair is built on. But so for the next 2 days, you'll be able to drive into the fair, and it takes about 15 or 20 minutes, and it kind of will wind through a little path. And they're going to have art exhibits. They're going to have the people who put in the quilts and all the exhibits they put in. They'll have animals out there for people to ride by and look at. You won't get out of your car, so but you'll be able to ride through. So even if it rains, which I don't think it will, you'll be able to go through. And then also starting tomorrow and running through Saturday, the food vendors are going to be out. So you'll be able to get fish fries and corn dogs and cotton candy and candy apples. But you'll go through the parking lot side of the fair and ride through there and be able to go through different lines and get food. So hopefully and all the money spent will go back into the scholarship fund. So, and again, questions?
Is this the 150th anniversary?
151st for our fair. So, yeah. So, but yeah. So hopefully everybody will be able to come. And it's all free. Just drive through. The food's not free, but everything else is free.
You answered my question.
Perfect. Yeah. So hopefully everybody will be able to get through and enjoy it. Thank you.
Thank you, Billy. I think a lot of people were wondering about that. But yes, it's free. Come get some food, take some pictures, starting tomorrow. Everybody remember to wear your masks today. We want to make everybody comfortable, especially our speaker today. Don't forget, for $10 you can get a Rotary mask like I have been wearing earlier. And all that will go to support our food packing event, which is going to be here on December 5th at 9 o'clock. We do need you all to come and bring friends and help pack food on Saturday, December 5th at 9 o'clock. Don't forget to thank Keith Hudson and Jim Hudson Automotive, who helped us with the initial purchase of those masks. Salvation Army bell ringing day captains are needed. It's been going around on the resources, but it's also going to be in the newsletter. Just email Andy Shane with the day that you would like to captain the bell ringing. Membership, we are going to have a Discover Rotary meeting on Monday, November 2nd. A little bit of stuff going on that week. But we will be here at 11:30 with a Discover Rotary meeting for anybody who has those folks who may be interested in joining this club or any Rotary club to come find out more information about our club and Rotary International in general. Everybody's gotten their fourth quarter invoices. Please pay them as soon as you can. The Board of Trustees for this that you all have elected for this club will be meeting in conjunction with all past presidents immediately following this meeting, and we're going to be in the room behind me, directly behind me, exactly after following this meeting. So please adjourn and go to that meeting as soon as we're done. Next, our speaker for the day. To introduce our speaker is President-elect Catherine Davis.
Good afternoon, everyone. It's my pleasure to introduce Dr. Robert Bo Cofield, Chief Executive Officer of Prisma Health Richland Hospital. Bo Cofield currently serves as the Chief Executive Officer, and it's located in Columbia, South Carolina. Prisma Health Richland is a 441-bed hospital that serves the Midlands region of the state by providing acute critical care, emergency, and procedural services through its Level 1 Trauma Center, dedicated heart hospital, and a children's hospital devoted to providing specialty and subspecialty pediatric care on the Richland campus. In his executive leadership role, Bo is responsible for the effective coordination and management of Richland Hospital's inpatient and outpatient clinical services and provides leadership for implementing Prisma Health's strategic plan with a guiding purpose to inspire health, serve with compassion, and be the difference. Prior to joining Prisma Health in April of 2020, Bo served as a Chief Clinical Operations Officer at the University of Kentucky's Enterprise, University of Kentucky in Healthcare. It is it's a 1,086-bed quaternary healthcare system. Bo completed his administrative fellowship at Tulane University Hospital and Clinics and received his Master of Health Administration and Doctor of Public Health degrees in Health Systems Management from the Tulane University School of Public Health and Tropical Medicine. He is a graduate of Hampden-Sydney College, a fellow of the American College of Healthcare Executives, and has enjoyed serving his community via nonprofit boards and leadership roles for organizations such as Bluegrass Care Navigators, March of Dimes, Hospice of the Piedmont, and the Make-A-Wish Foundation. Bo enjoys spending time on the golf course with his son Alex, who's 17, and in the horse ring and field with his daughter Watson, who's 15. All three of them enjoy spending time with one another on the lake, at the beach, and hiking with their family dog, Buddy. Please join me in welcoming Dr. Bo Cofield.
Thank you very much for that kind introduction, Catherine, and for the invitation to join you all for all I want to do these days. I'll clean up here and get going. The opportunity to speak in front of you today is a welcome one for a variety of reasons. One of which is getting to share the Prisma Health story as it relates to the response here in South Carolina to the pandemic. Been very fortunate to have been here now at Richland Hospital. Be 5 months next week. Interesting time to relocate. Interesting time to interview for a new job, to start a new job. I never thought that interviewing for the CEO of a 641-bed hospital would involve Skype to the extent that it did. But certainly very glad to be here, and want to thank everybody for having me here today. So during these unprecedented times, we all have stories to share about the impact of COVID-19 on ourselves, on our families, on our businesses. And today I'm going to share Prisma Health's story. Well, the story so far, because as everybody knows, we're not through this yet. And I'm sure that everybody in this room or in a virtual room participating with us today hopes it's a shorter story as time goes on, rather than longer. I think somebody on Friday in one of our meetings referred to the day as October 724th. It just seems like time continues to crawl on. So a little bit about Prisma Health. Make sure that this is on.
Is it on?
Don't think so. You can just advance the slide for me, it'd be fine. There we go. So who we are today. So you've seen Prisma Health come together in the last 3 years as Palmetto Health and Greenville Health System. Palmetto Health being here in the Midlands, Greenville Health System, of course, being in the upstate. Our goal and why Prisma Health was formed remains true today, to improve the health of our patients and the communities that we serve. Gaining the benefits of scale is something that really brought us together to enhance quality, improve access, and address healthcare affordability issues across the state of South Carolina. So today we're nearly 30,000 team members between the Midlands and the upstate, serving more than 1.2 million unique patients every year. We are made up of 18 hospitals, 2,964 beds across the state, and 300 physician practice sites. We are South Carolina's largest health employer and second largest private employer in the state. We also conduct clinical research, participate in technology development, and share advancements in those fields through our health sciences offices of innovation. And we spend a lot of time training the next generation of physicians, nurses, social workers, and other health-related professions. Here in the Midlands, we're made up of 4 hospitals. Richland Hospital, where I'm fortunate enough to serve as the Chief Executive Officer, Baptist Health Downtown, and Baptist Health Park Ridge, where Mike Bundy is the CEO of those 2 facilities. And then Toomey Medical Center in Sumter is a part of the Midlands region of Prisma Health. Next slide, please. So, I mentioned a little bit ago about scale. and it really took Prisma as a system operating at scale to confront the COVID-19 pandemic. As a healthcare leader, I can say with certainty that it would have been immensely more challenging for us to do our job if we did not have the resources that we do here at Prisma Health. Not only are we well positioned to continue caring for our own patients, but we're well positioned to care for patients and step in and help people in other hospitals, in skilled nursing facilities, government agencies, and others as they respond to the COVID-19 pandemic. I'm told that we began preparing for COVID-19 well before it arrived in a January timeframe and formally stood up our incident management team prior to the identification of the first case in South Carolina. Interesting fact, I interviewed on the second Tuesday of the month in March, which was just 3 short days after Richland admitted the first COVID positive patient in the state of South Carolina to our surgical step-down unit. The system-wide incident command oversight structure that we used here has served us quite well, and so we've really been operating Prisma in response to the pandemic as one large organization, not individual hospitals, so that we can move resources where they need to be to care for where the patients are, whether they're in the upstate or in the Midlands. And we continue to collaborate closely with other healthcare delivery systems, such as the Lexington Medical Center, and others across the state to coordinate activities in these unprecedented times. And it really has taken all 30,000 of us to step up and be prepared to respond to this. So earlier this month, we reached a solemn milestone in the United States here, where we had more than 200,000 confirmed deaths since the pandemic began. I looked at where we were this morning, and it's just a little over 219,600 deaths in the United States, and with just over 8.1 million identified cases, which is a 2.7% case fatality rate. Certainly much higher than any of us would like it to be. In South Carolina, the total number of confirmed deaths is at more than 3,100, according to the Department of Health and Environmental Control. But as the pandemic progresses, we actually have sort of leveled out in the number of COVID-19 inpatients in our facilities across Prisma Health and across the state of South Carolina. We're actually all obligated to report our daily totals to both the federal government and the state government, so we've got a view into those things, and it's pretty stable. It's been stable here in the Midlands as well. On October 1st, we had 55 inpatients across our 4 hospitals. Today it sits at 41, so it's been on a stable, maybe 1 a day coming down on average since the beginning of October, and we of course hope that will stand. As a healthcare organization, across all of our integrated delivery sites, we've cared for more than 2,700 inpatients. That's at the ICU level and at the general floor care level as well. And that actually represents about 30% of all of the COVID inpatients in the state of South Carolina through our facilities. So today, South Carolina stands at a 7-day moving average of about 10.8% positivity rate, so still fairly high, in the top 20 in the United States at present. As I mentioned earlier, we're sitting at about 40 in the Midlands at this point in time. At any given time, and it actually fluctuates nearly day to day, we're somewhere between 15% and 35% of those 40 or so patients that we've got today, or we'll have tomorrow, whatever the case may be, in an ICU level of care. What we're starting to see is a sicker patient population, so we've been on the higher end of that, quite frankly, of late. So in the early phase of the COVID-19 pandemic, we stood up a rapid innovation task force to help deal with the issues and challenges that we knew that we would face. And that task phase was to address the unique challenges that we were facing from the unprecedented public health emergency. And so it was a vehicle for us to pilot and execute novel ideas, as an example, BioQuil. Let us act in multidisciplinary fashion with leaders, entrepreneurs, and industry experts to address real-time problems. So as an example, hand sanitizer. Well, the governor issued a proclamation that permitted distilleries to get into the business of hand sanitizer. we actually started doing that, and then we transitioned some of that activity with materials that they could supply into our pharmacies so that we could use that hand sanitizer in the delivery of care to our patients and in the protection of our team members and our physicians as well. And so we've also participated in over 18 COVID clinical trials at Prisma facilities. The remdesivir trial is an example of that. Plasma replacement is one of those as well. And I think some of the most important things that we've done in the world of innovation here is figuring out how to connect our patients with their families. Very difficult when we were basically on lockdown inside of our hospitals and not permitting anybody inside the four walls of the hospital unless someone really needed a caregiver because they didn't have the capacity to understand treatment plans, or at the end of a discharge. And certainly with our kiddos in the children's hospital, we permitted parents. We started our therapeutic plasma exchange program, actually with 2 trials. The first donor to that was actually one of our doctors who had come down with COVID and volunteered to be the first to make that donation. And then you can see some of the other therapies that we offered here as well. If you would flip to the next slide, please. So one of the other things that we did, I mentioned connecting our patients and their families. We also had to figure out ways to continue to meet the needs of our patients who required care. Of course, our emergency departments remained open. Our volumes actually plummeted by about 50% in our emergency departments. People afraid to come to the hospital, and perhaps appropriately so in one's mind, but I'll tell you, the hospital is probably one of the safest places to be in a time of pandemic because we're all wearing our masks, we're all washing our hands all the time, and that's just a part of what it is that we do. But connecting with our patients who need our services, we basically went from almost, I won't say negligible, but very small amounts of telemedicine occurring here in South Carolina, and this is a national phenomenon. Since, or as of the 15th of October, we've delivered just under 375 telehealth visits to patients needing our services via a virtual mechanism of some sort. The platform for that, in large part, was a protected version of Zoom. We're moving to Microsoft Teams to be able to do that. I've actually been the recipient of these services on 2 occasions, one here in South Carolina and one with my doctor, my former physician in Kentucky. And it's remarkably intriguing how to interact, and that new way of interaction. But our patients tell us that they like it, and their loved ones enjoy it as well because they're able to participate in those forums as well. And you can see some of the benefits here. It's convenient, it's affordable, safe and secure. You can get your prescriptions, and it is a high quality service. Just to be sure that that is the case, we do have people paying attention to how many of our patients have a telehealth visit and then end up in our emergency department. And is that any different than it would have been pre-pandemic in terms of the number of patients coming into our clinics and then showing up in an emergency department? It turns out the rates are about the same. What we have observed, however, is that when they get to our emergency department, they are typically sicker than they were pre-pandemic. Historically, at the Richland campus, we've admitted about 21% of our patients who present in our emergency department. Since the beginning of April, that number has been right around 27.5%, and more of them are going to critical care than we've experienced in the past as well. In terms of one of the things that was absolutely positively front and center in the popular media was the supply chain. Where do we get all of this personal protective equipment? And Prisma, because of its scale and size, had a lot of buying power. And we were able to exercise that buying power by being sure that our team members and to some extent the state of South Carolina had the PPE that they needed in order to, one, protect ourselves, but two, be sure that our patients and our team members were protected as well. We've got great supply chain team leadership, but you can see Mr. O'Hala and Governor McMaster there accepting 1.3 million masks on a tarmac in Greenville. And we have example after example after example of that kind of effort to be sure that South Carolina has the supplies it is that we need. If you flip to the next slide, we donated or provided a cost to just about every healthcare provider here in the state of South Carolina because we were able to use our scale and buying power. I will tell you today that the supply chain has essentially caught up in the world personal protective equipment. So you shouldn't see shortages of masks or coveralls, eye protection, those kinds of things going forward. We are still dealing with supply chain issues with some of our drugs, some of our equipment, where people have pivoted away from, as an example, pharmaceutical companies pivoting away from making certain drugs so that they could make hand sanitizer, because that's what the market needed at that point in time. We've also been in a position to loan some of our equipment to Kershaw and to McLeod in order to support the needs of their patients. I'm fortunate to have the luxury to be able to do that here at Prisma Health. Next slide, please. Another big thing that we stood up is our COVID-19 testing. We had inpatient, drive-through, and community testing all over the state, actually. And we've tested 163,000 patients, about a 14.7% positivity rate for the patients that we have tested, and that includes our inpatients, the drive-through testing, and those kinds of things. 81,000, just roughly half of the 163,000, were through a drive-through mechanism here in Columbia. That is on the Richland campus in our NP14 garage. They're doing the same thing at Greenville Memorial, and a good community asset that has been taken advantage of. We've also hosted 75 community testing events, which provided 36,000 tests to the community, and in close consultation with community leaders and with DHEC, we identified and prioritized the testing locations so that we could get the biggest bang for our buck. I'll tell you that we're actually also beginning to add flu shots to our drive. We have added flu shots to our drive-through testing locations. We will also begin adding. They started today in the upstate market, adding flu tests to our drive-through testing as well. So we'll be able to provide that here in the Columbia market relatively shortly. Go to the next slide. So just reaching populations who may not have access to traditional testing. I mentioned we've tested 36,075 plus events in collaboration with DHEC. The test results in Hispanic communities reached a positivity rate as a high of 42% in early summer. I saw a figure today from the CDC that in some communities that is still at 26%. Across the United States, of course, some higher, some lower. And in order to be sure that we were reaching that population, we shepherded an educational campaign through Hispanic radio, Spanish cable TV about COVID-19 and testing messaging. So we've also tried to do our best to share expertise in our communities. There were 5,377 COVID-related news stories that mention the word Prisma over the course of the pandemic so far, so that we can participate in state and community hosted briefings, and we have hosted ongoing Prisma Health news conferences. Physician radio interviews, South Carolina Biz, and those kinds of things have been very important to us. And the main message that we're trying now to get across now using TV, radio, social media, and our website is to continue, the triple threat here: wash your hands, wear your mask, and socially distance. And if you'll flip to the next slide, we actually hosted a campaign where we provided all of our team members with this bright red T-shirt, encouraging people to stand 6 feet apart. And if you look at our Facebook page, our Twitter feeds, and those kinds of things, it seemed to have a dramatic impact. We're all asked to wear this shirt. On August 1st, I was actually in Kentucky at an event with my children. I wore my red shirt to help share the message about just how important it is to continue to socially distance. So we're still in the middle of it. Please don't let your guard down. Here are the tips and tricks. I mentioned the 3 most important components of that just a moment ago. But don't forget that more than 143,000 people in our state have tested positive for COVID-19, and more than 3,100 have died from this disease as of October 2nd here in the state of South Carolina. So we must remain vigilant in the midst of this pandemic, and each of us has a responsibility to do our part. And last but not least, it really is all about the patient. We are in a fortunate position to be able to serve, proud to be able to serve, and we have tons and tons of stories that we can share. But I think one of our patients said it best. Entered the hospital alone, but what I found was a group of people who were ready to be my family over the next 72 hours. I heard a story about that actually this morning from one of our patients who I happen to know personally and sent me a text message. So I want to thank you for letting us share the Prisma Health story, and happy to take any questions. Yes, sir, in the back.
I often read that there's so many beds, available, and I'm trying to figure out why that matters when, in fact, as the beds come down, that gives you opportunities to fill them up with services. So there's no real relationship there on the beds available. Is there a goal, like you want to have 20% of the beds filled? Is there something to share about the numbers of beds in ICU?
Yeah, I think what's most important is we want to, so each hospital and Prisma as a whole has what we call a surge plan. And we pay attention to the number of beds that we've got available to us because that triggers certain elements in our surge plan, such as bringing extra staff in or making a unit entirely made up of COVID patients and turning rooms into negative pressure. And the state pays attention to this so that they know where the assets live, so that if the state as a whole surges and we get into full-fledged disaster mode, they can help make decisions about what resources get allocated where. So that's why we tend to pay attention to it. Yes?
I have a question with regards to the telehealth and the emergency telehealth in lieu of emergency room visits. Do you see that trend continuing, and what, if any, impact do you think it's going to have on the overall healthcare costs?
So we are actually discouraging people from telehealth emergency room visits. If you're sick enough to believe that you need an emergency room, please go to the emergency room. That's an important thing that I can't stress enough. But I do expect that we will continue to see this telehealth at the level it is. So as an example, our behavioral health services department, so psychiatry, is pretty much going to try and remain telehealth. It's more efficient for the patients. It's more efficient for the providers as well. There's a huge unmet need. We have appointments scheduled months out in the behavioral health world. This has actually helped us get to weeks out rather than months because we can get through more patients on a daily basis. And so there's certain elements of our clinical enterprise that will remain largely based on telehealth. That should have a positive impact on the cost of healthcare services. What is yet unknown is will it continue to have that deleterious impact that we're having on the health and well-being of society with patients showing up when they get to a clinic, they're sicker than they might have typically been. When they get to the emergency department, they're sicker than they might have been. So our care providers are having to learn to sense weaker signals than they might see if they're face-to-face with their patients. Answer your question? Great. Yes, sir.
Yeah, so I read about the classification of COVID patients, and there's some dispute about if someone checks into a hospital for elective surgery, they test positive for COVID, they're then a COVID patient. How do you classify at Prisma for someone that's not symptomatic for COVID? And if it's different than the numbers you showed here, what percentage breakdown would you say are people that are admitted because of COVID symptoms or ones that come in for other things and test positive?
I don't have that number off the top of my head, unfortunately. It is, I would not say a significant proportion, because we're only testing actually if they are symptomatic. And so I couldn't necessarily tell you. The way that the coding and documentation actually works is when we document the care and when we say submit a bill that would identify the final diagnosis of the patient, as it were, it actually floats up to whatever services generated the largest amount of resource utilization. So if you come in for an ambulatory surgery procedure and for whatever reason you end up staying overnight, you start to exhibit symptoms. More often than not, yes, you will have COVID documented on your discharge summary and in your bill, and it will be counted. But in terms of what we would get paid for and what we would consider the patient would be focused with that surgical encounter. Yes, sir?
There's a wide range of testing types. We keep hearing about the one that really is invasive, probably the best. Have they gotten any better with some of the quicker tests? I mean, how accurate are these quick tests?
So the quick tests are still, the jury is still out with some of the quick tests, with the exception of any test that is at the molecular level. So what we call PCR testing is in large part equally as valid whether you're doing the turnaround time in a 24-hour time period or you're putting it on the machine that gets you an hour. The false positive and false negative rates are nearly identical between those two platforms because you're using the same basis, which is at the molecular level. The development of things like the saliva test, which is the real rapid test, as I said just a moment ago, the jury is still out on some of those. They call it a novel disease for a reason because it's new for all of us, and so the testing that comes along with it, the care of the patient that comes along with it is all new to us as well. And so I imagine I know that as time goes on, you'll actually we'll be in a position to see some peer-reviewed publications. Right now, they're almost all stories from the front lines of what people have experienced, and so that's why you hear so many varying, for lack of better terminology, stories. Some are true, some aren't, but they're experiences that people are having depending upon where you are in the country and what it is that you're doing.
I have a quick follow-up question. Where can we go to find good resources for information like that?
You can go to the prismahealth.org website
Thank you.
and learn about that. I would also suggest Johns Hopkins has a good bit of information, as does the CDC website, which is what we typically turn to, is what the CDC tells us is the way to react.
And is the CDC political in any way?
To my knowledge, no.
Okay.
I respond and react to the facts as they're presented. That's what our clinicians do. Clinicians do as well.
Can you stick around now to answer some questions?
I'd be glad to stick around, and please, you have some wipes in front of your place. Use them willingly and often, please.
Thank you both for being here. We appreciate it. We have a little token of appreciation. It's been wiped down with one of your wipes there, so we appreciate it. Thank you for the information, and we appreciate you sticking around and answering a few more questions.
Gladly. Thank you so much for having me.
Appreciate it. President-elect Catherine, who is our speaker next week?
Next week, we will hear from Ms. Pat Littlejohn, who is the Executive Director of the South Carolina Center for Fathers and Families.
We have lost Rusty because he had to go back to do the voting thing, so we have no piano player. We've lost Audrey, so we've lost our singer. I'm not singing. This meeting is adjourned.
Yeah, I hope they're good.